no need of selection of much medicines. That means beating around, we can avoid the term that is beating around the bush. With one or two medicines, we can get the exact result what we expect, or at the same time, we may get the little more, the more result that we expect from the higher or with a more number of medicines. See, if we are mixing of so many medicines, there can be a drug-to-drug interaction. So we may not get the proper result what we expect. So always better to reduce the number of medicines as much as possible. Then only we can forecast the result. So for how we have to reduce the medicines, for that purpose, we should know thoroughly regarding the properties of each and every medicine. We should know where we have to give this medicine and where we have to give the other medicine, or we have to give where we should avoid such kind of medicines. So such matters we should be very thorough. For that purpose, we should analyze the nature of each and every yogas precisely or critically. So how to carry out that we will see. We know these are the Swasaroga Nidanas. Everyone knows that. All of us have studied in the second year Nidana paper as well as the the Tai Chikitsa paper. But I'm not going to the details of the theoretical part. Just whatever the things which we need to understand the further practical aspects, we need little bit theory part. So I'm explaining only that part. I'm just picking from that such topics from the Samhitas and making into the practically applicable form. So I'm not a theoretician actually. I'm not a teacher, and I'm a typical practitioner as well as a pharmacy person. I'm working as a consultant as a senior physician in the quality control department as well as this research and development department. So always my focus is to not the theoretical part but the practical as well as the manufacturing part. So what are the permutations and combinations what we can make with our different kind of medicine, that we will see. So we know that the Nidana part. Dhumopaghata, Rajasastadheva, Vyayama Rukshana Nishevanacha, Vimargagatwadavi Bhojanasya, Vegavarodhat Kshavatoshadasya. These are the Nidanas what we have done. Dhumopaghata, Rajasastadheva, Vyayama Rukshana Nishevanacha, Vimargagatwadavi Bhojanasya. So we will keep that part apart. Now comes the most important part of our treatment, the Samprapti. That is Pranagni Udananugata Pradishta Sambhinna Kamsya Sunatulya Kosha. Pranahi Udananugata Pradishta Sambhinna Kamsya Sunatulya Kosha. So the affected or the vitiated doshas are, it is Vata only, and precisely it is Prana and Udana. And when we come to the Samprapti, Acharya clearly explained Atha Pradhihato Vayu. Atha Pradhihato Vayu means what will be the condition. Atha Pradhihato Vayu Urdhvastroda Samasrada Udana Rupamapanna. So what is the medicine? What is the dosha vitiated here? Which is Atha Pradhihato Adho Vayu. Atha Pradhihato Vayu Urdhvastroda Samasrada. The Vayu which has been situated in the lower part of the body, which has blocked, and Udana Rupamapanna, which has attained the properties of Udana. What is Udana? Ud Nayati. That is, Ud Nayati means nothing but which has got the property of moving upwards. What is Apana? Up Nayati. That is which goes downwards. So here the Apana Vata is getting blocked with some other factors, which are the factors that we will see. So with that the Apana Vata is getting blocked with some factors, and the natural flow or the natural movement of Apana Vata is being reversed, and Udana Rupamapanna. This Apana Vata gets the properties as well as the Rupa, the symptoms, the Lakshanas like Udana Vata, and then does the disease manifestation. So here this is the important one. The avarana of Vata. The first one is Nidana Sevana, that is Dhumopakatha, Rajasastadheva, Vyayama Rukshana Sevanacha, such because of that nidana. You see that nidanas, even though we know that the symptoms what we get during kasa or swasa is nothing but it's more or less similar to kabhaja roga, isn't it? A severe expectoration, otherwise severe chest discomfort, heaviness to the chest, etc. But still, see the nidanas. Everything, all the nidanas are vada prabhava nidanas only. Bhumabhaghada, Reja, Vyayama, Ruksha Anna Nishevana. Then again, Vimargagatwada Vibhojanasya. Everything are Vadagoba nidanas. So here, due to the important vitiation of Apana Vada, and then because of the avarana of Kapha or Pitta, the Apana Vada is getting blocked with the other factors and getting the Surupa of Udana Vada. Then and locates Kantha and Uras. Urdhva Srodha Samasrada. Then fills in the Srodhas and produces Kasa. This is the simple Samprapti of Kasa. And we can select the medicine only when we are thorough with this Samprapti. How this Samprapti can be made applicable to the practical aspects. Don't think that these are directly just simple theories only, but always this type of theory, the practice of Ayurveda is the foundation of Ayurveda is typically based on this type of theory only. So we will see how we can apply this theory to the practice field. And once the Kasa is developed, definitely next Kasa Vruthya Bhave Swasam, Purvairva Doshakomare, Amadisara Vamathu. Like that it's continuous. So now we will see. So we will see the classification of Kasa, isn't it? We know that Pancha Kasa, isn't it? So Vata, Pitta, Kapha, Kshayaja and Kshadaja. But for treatment purpose, this much classification is not sufficient. We need to go in little more detail regarding the classification part. Then only we can select the medicines precisely. So simple Vadika Kasa, diagnosing simple Vadika Kasa is not sufficient. Simple Paitika Kasa is not sufficient to reduce the number of medicines. But how to reduce that? How to disintegrate the classifications little more precisely, that we will see. See, when we go to the practice field, when we go to the medicine field, we have to differentiate the treatment for Vata. Definitely there are 5 types of Kasa only. Vata, Pitta, Kapha, Kshata and Kshaya. But simply diagnosing Vadika Kasa is not sufficient to get the proper treatment, the result. Because the line of treatment explained by Acharyas in Vadika Kasa, which is occurring to the Vata Prakriti person, and the Vadika Kasa occurring to the Pitta Kapha Prakriti person are entirely different. At the same time, the Paitika Kasa, simple Paitika Kasa is not sufficient because there are 2 types of the Paitika Kasa is being again subdivided into 2. That is Paitika Kasa with Tanu Kapha and Paitika Kasa with Ghana Kapha. Here also the treatment is entirely different. Again, the next one is Kaphaja Kasa. When we go to Kaphaja Kasa, again there are 2 types. Kaphaja Kasa occurring to the Balavan or Kaphaja Kasa occurring to the Durbala person. The treatment line is entirely different. How we can select the yogas according to these precise classification, that we will see now. We will discuss as presenting complaint, as case by case we will discuss. So, shall we go to the first case? A male patient came to us with severe dry cough, with severe resonance since 1 week, associated with throat dryness, headache and lethargy. These problems seem to be increased immediately after food and early morning around 3 to 4 a.m. His complaints were little bit reduced while sipping hot water, lime juice with sainthava or lime juice with salt and warm water. Again, at the same time, when we go to little more deeper, when we ask little more leading questions to the patient, he reveals the history of habitual constipation irregular appetite, and disturbed sleep. Again, he has got severe inability to withstand cold climate, cold wind, etc. Whenever he exposed to cold climate or cold wind, the problems get worse. So what could be the diagnosis? Yeah, you can, I think we will make it an interactive session. You can post the answers in the chat box. Can anyone? What type of kasa is this? Is it Vatika kasa or Paitika kasa or Kapacha kasa? Yeah, Vatika kasa, Vatika. Okay. Definitely. Oh, someone has Paitika kasa. Okay, let it be, no problem. Vataja kasa, Vatika, Pittaja. So now we will see. It is typical Vatika kasa only. Yeah, Pittaja. So many answers, confusing. Actually, I am also got confused now. So there are, yeah, so the majority is for Vatika kasa. Definitely, we will fix on Vatika kasa itself. So, what type of Vatika kasa? That is the main thing. As I explained, the treatment explained by Acharyas for Vatika kasa, for Vatika kasa occurring to the, what we say, the previous one. There are two types of Vatika kasa, isn't it? I explained. One second. So I will go to the previous slide. I am not able to change the slide. You can see this slide should be thorough with everyone's mind. Then only the further case we can explain. So Vatika kasa for Vata Prakriti person, Vatika kasa for Pitta Kapha Prakriti person. So please do concentrate on this slide. So now, by keeping that purview in the mind, now you think of this case. The leading factors are nothing but the symptoms are severe dry cough with a resonance. Kupitam Vadalayar Vadam Shushkora Kanthavaktratam. Again, Krip Parshola Sirashola Mohak Shobha Swarekshayan. Now, these are the pointers to the diagnosis. That is nothing but Vatika kasa. And the other things are the confirmatory sign. Immediately after food, the problems seems to be increased immediately after food and early morning, around 3 to 4 a.m. Why that time? That is the main thing. That is the Vada predominant kala, isn't it? Grishma ahoratri bhuktande pragupyandi samirana snigdhamla levanoshnescha shamam. So just we have to ask the patient some of the leading questions. So which is the Vatika kasa? That is very difficult to diagnose. But at the same time, if we ask to the patient, so do you get any disturbance regarding the during your sleep? Are you getting disturbed due to cough during sleep? Definitely, he will explain. He will say, the patient will say that yes, I am getting the different the difficulties during. At the time, most of the time, he says that when I get awakened for passing urine at the time of maybe around 2 o'clock or 3 o'clock, severe irritation is there, and see the cough is getting increased. So we will ask again. Then how do you subside that? Whether it gets subside simply? No. He will say that no problem. Just when I drink some little bit warm water or water with salt, definitely the problems get subsided. These are the pointers to the associated symptoms, the associated vitiation of dosha. Again, snigdha amla levanoshnescha bhukta pidei prashamyati grishma aho ratri bhuktande pragupyandi samirana. So, and now the diagnosis is Vatika kasa. Now the another thing is, we have to diagnose whether he is a Vada Prakriti person or Pitta Kapha Prakriti person, because the treatment is differ in Vada Prakriti as well as Pitta Prakriti person. So, from the symptoms like habitual constipation, irregular appetite, and disturbed sleep, and Shita Sahishnudha, the inability to withstand cold and cold climates, points to the Vada Prakriti nature of the patient. So here we can diagnose the disease as Vadika Kasa occurring to the Vada Prakriti person. Now we will go to the treatment. Again, Vadika Kasa occurring to the Vada Prakriti person. So the Samprapti goes like this. Because of Vada Kopa Nidhanas. What are the Vada Kopa Nidhanas? Tiktoshana Kashayalpa, Ruksha Pramita Bhojani, Dharana, Udirana, Nisha, Jagara, Atucha Bhashani, Kriyadi Yoga, Bhi, Shogam, Chinda, Vyayama Garshini, Krishma Horatri Bhuktande, Prabhupyandi Samaya. Because of these type of Nidhanas, there is the increase of Vata in Koshna without Avarana. This is why I told that the first Samprapti is very important. There are two types of Sampraptis. One, the Samprapti with Avarana, and another one is Samprapti without Avarana. So here, in case of typical Vadika Kasa, absolutely there is no Avarana. And thereby, the treatment also differs from the other set. Here, without Avarana, because of the highly increased the Apana Vada or Udana Vada, so that moves upwards and locates over here without any obstruction, and that causes excessive dryness towards the chest as well as the larynx or whatever it may be. The entire respiratory tract produces kasam, and from this kasam it goes to swasam. Now, again, when we come to the treatment line, the treatment is Rukshasya Anilajam Kasam Adau Snehe Rupachari. Many a times we do mistakes. Even I also committed mistakes in the previously. Severe cough itself and the dry cough, even though it is severe dry cough itself, most of the time we give Elakanadi Kashaya or Dasamulakadatrayam Kashaya or Vyagrayadi Kashaya, like that. Definitely, such a prescription, we have a habit of giving this, what we say by default, Dasamulakadatrayam or Indukanta, whatever may be the cough, whatever may be the kasa, or whatever may be the swasam. Our first line of thought goes to this type of medicine, that is Dasamulakadatrayam or Vyagrayadi or Indukantam or Balaji Ragadi, etc. But in this case, such an approach is entirely wrong, because this is purely Vadika, and there we should start with the Rukshasya Anilajam Kasa. Vadika Kasa occurring to a Ruksha person, that is nothing, Ruksha person is nothing but a Vada Prakriti person. So, Anilaja Kasa occurring to a Ruksha person should be treated with Adau Snehe Rupachari. We should start the treatment with the Sneha Prayoga. There is one Apana, or when the context of Vata Vyadhi, there is one line called Tam Snigdhair Anulomaya. We have to do this Anulomana, especially in this type of Vadika conditions. We have to do this Anulomana with the Snigdha Dravya. How to do the Anulomana with the Snigdha Dravya? So mainly, we will discuss the properties of this and all these medicines in later. Now I will just demonstrate the set of medicines. So initially, in this case, if the Agni is proper and there is no other Ama Lakshanas, etc., we can directly go for the Snigdha Prayoga. What could be the Ama Lakshana? The Agni is proper. That how to understand whether if the patient is suitable for Snigdha Prayoga or Drita Prayoga or not. That we have to fetch from the Jurajigals. That is Kashaya Panapatyana Dashahayridilinkita. Again, Vada Vittotare Jure. Kaphe Mande Vada Vittotare Jure. So if the patient is, when the kapha is reduced and the condition is Vada Vitta Pradana, you have to go for this type of Snigdha Prayoga. That is, probably you can use three types of medical pradas. Usually I use in my practice. That is, one is Indugatam, the second one is Vidaryadi, and third one is Rasna Dasimuladi. And Arishtam, Abhayarishtam as well as Dhirarishtam. But there is one difficulty in using Arishta. We don't use, most probably this Abhayarishtam, etc., are the most underestimated medicine. Abhayarishtam is the wonderful medicine in Kasa. But the only thing is, the person is Ruksha, the person is Vada Pradhana, the disease is also Vada Pradhana. Arishta is also Ruksha. Arishta is also Vada Provaga. So here, even though it is Anulomana, so we have to do the Snigdha Anulomana here. You can mix, the best method is you can mix this Arishta with the Grida. That need not be the medicated Gridas like Indugandham or Vidaria. The simple cow's ghee is sufficient. Usually, I do in my practice like that. 20 ml of Abhyarishta with 2.5 gram or 2.5 ml of simple cow's ghee twice daily after food. Alone is sufficient for the Vadika Kasa occurring to the Vada Prakriti person. You can just try. Absolutely, there is no need of any other medicine. This is for sure. You can just try this Abhyarishta with any of the Grida after, probably after food, and that alone will be sufficient. The same effect we can get through Jiragarishta also. Now let's go to the second. A male age 15 years. Again, simple dry cough with the resonance. Since 1 week, associated with the postnasal drip. The problems seems to be increased immediately after food. The symptoms are more or less similar after food and early morning around 3 to 4 a.m. The boy explains that definitely, yeah, I get increase of cough. Or most of the time he explains as usually, yeah, I get awakened or get up at the time of 3 or at the time of 2 o'clock because of the increased cough. And the same thing, what do you do for reducing the symptoms? Definitely he said that I will just drink some of the warm water mixed with or salt or just simple lime juice, and gradually the problem reduces. Here, the difference lies is his bowel history is normal, but had a history of recurrent loose stools. His appetite was reduced since childhood. What could be the diagnosis? Symptoms, the chief complaints are similar to the previous one, but the associated complaints, previously he was suffering from habitual constipation, irregular bowel movements, or irregular abdominal distension, etc. But in this condition, the bowel history is normal. At the same time, he was suffering loose stools properly. So his appetite and with the reduced appetite. What could be the, again, inability to withstand cold climate, cold wind, etc. What could be the diagnosis? Again, Vadika Kasa only, yeah. Vadika Kasa, no, not Vada Paitika Kasa. Yes, no, it's not Pitta Kapha Prakriti. Yeah, exactly. Vadika Kasa occurring to the Pitta Kapha Prakriti. Definitely. That is the typical diagnosis here. And the treatment here also is important. Previously, the simple dry cough, what I said is that comes Nikhair and Rukshasya Nilajam Kasam Madhu Snehe Vajre. That line is entirely wrong in this condition. Here, how to treat. Vadika Kasa occurring to the Kapha Prakriti person or Pitta Prakriti person, whatever it may be. Here, previously it was Anulomanam, then Pajanam and Brahmanam. And here also Anulomanam at the same time Shamanam and Brahmanam. How to select the medicine? So we can select the medicine. Here we can adopt some of the Kashaya Yogas. Definitely, if it is a Vadika Kasa occurring to the Vada Prakriti person, never goes to any of the Kashaya Prayogas. So here we can select the Kashayas such as Nayopayam, Balajiragadi or Indugandham. There are some Churnas, there are Churna options here. Talisapatradi Churna or Talisapatradi Lehya. These two are the preferable medicines preferable medicines which I follow in my practice. How to differentiate these, that we will see later. Now, we will see the third case. Again, male 30 years. Presented with yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, dysphonia. Excuse me. Hello? Yes. There are class, never meeting. Sorry. So, yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, and dysphonia. Previously, the problems increased at the time of 3 or 4, and now definitely he explained this. He gets awakened mostly at the time of midnight, probably 12 o'clock, in between 12 to 2. The problems increases and he used to get up. His cough seemed to be increased between or immediately after food intake. What could be the diagnosis? His bowel history is normal. He was suffering from chronic heartburn, belching, and sore throat. Sleep pattern was disturbed due to the heartburn. In between the sleep also he gets severe heartburn and belching, and he gets to wake up. On auscultation, everything was normal, and absolutely the heart sounds, everything were normal, no other symptoms, systemic problems. What could be the diagnosis? Exactly, Pitta Jagasa with the Tanu Kapha. Very good. So you are picking up. Very good. Thank you. So Pitta Jagasa with the Tanu Kapha. Exactly. Pitta Pidakshi Kapha. Tikta Sittum. You can, if you ask to the patients, definitely word by word they will explain. Pitta Pidakshi Kapha. Tikta Sittum. Joro Brahmam. Pitta Srikvamanam Trishna. Vaisuryam. Dhumago Amlagam. Burning sensation. Amlagam, this about belching, and when the problems increase, Sharan, Madhyana, Ratri Artha, Vidahasyamayeshu cha, the problems gets increased. The other problems will be there will not be any associated complaints like constipation or abdominal discomfort, abdominal distension, etc. At the same time, you feel tiktasida, bitter taste in mouth, as well as this burning abdomen, etc. Now, the treatment. Here the diagnosis is Paitika Kasam with Tanu Kapham. And as per modern science, we can diagnose it as cough due to GERD, gastroesophageal reflux disease, which is termed as, there is a typical correlation with the Paitika Kasa with Tanu Kapha with the modern medicine. What could be that? That is called as LPRD, that is laryngopharyngeal reflux disease. The problem occurring due to the excessive hyperacidity, and the upward moved bile or acid gastric content, it gets irritates the larynx as well as pharynx, as well as especially the trachea, etc., and produces the kasa. That is known as laryngopharyngeal reflux disease, or what is the cough due to GERD. And what should be the line of treatment? Again, there are what I will tell you the line later. Shamanam, Anulomanam, and Viryajanam. Paitika Kasa with the Tanu Kapha and Paitika Kasa with the Ghana Kapha. The treatment line is entirely different. That is Snigdha Sheetam Tanu Kaphe, Yuksha Sheetam Ghana Kaphe, Karma Karya Param Bhojyas, Nehe Lehe Chasasyade. In case of Paitika Kasa with the Tanu Kapha, we should treat the medicine with the patient with the medicines with the properties like Snigdha and Sheeta. And in the case of Paitika Kasa with the Ghana Kapha, the medicine should be Ruksha Sheeta. The line is similar, Shamanam, Anulomanam, and Viryajanam only in both the conditions, but the properties of the medicine are different. Here, in the case of Paitika Kasa with the Tanu Kapha, again we can use this Nayopayam, Uluchyadi, Drakshadi, or Pushkara Erandadi. There is another very effective yoga called Pushkara Erandadi. It is explained in the Gulmadi Vilsava of Ashtanga Hridaya. And probably there is a tablet called Acidact by Kotakilari Vilsala. That is made up of this yoga. Pushkara Erandadi is a very effective yoga in this type of condition. That is, the only 4 medicines are there. Pushkara Erandayor Moolam, Yavam Dhanvaya Vasayam. Jalena Pudhitam Pidam, Koshtadaharu Japa. You can see the indication. Koshtadaharu Japa. See the ingredients. Pushkara Mula, Pushkara Eranda Mula, Yava, and Dhanvayasha. That is nothing but Duspasha. Regarding Churnas, Avipatti, Sitobaladi, etc., we can use this condition. And regarding this Leha, Villuadi, we can use Nayopayam and Draksha. We will compare this yogas later. Now the fourth case. Male 40 years presented with complaints of severe cough with yellowish thick sputum since 1 month associated with nausea, vomiting and muscle cramps and fatigue. This problem seems to be increased at early morning around 4 to 5 a.m. This cough seemed to be increased between or immediately after food intake. Had a history of chronic smoking. On examination, on auscultation, mainly diffuse wheezes. We can see the severe wheezing with high-pitched continuous heart sounds. So what could be the diagnosis? Male 40 years, the diagnostic part is severe cough with yellowish thick sputum since 1 month associated with nausea and vomiting, muscle cramps and fatigue. Paithiga kasa with ghana kapha. We can correlate this as acute bronchitis or the chronic bronchitis. See the symptoms. The only difference is nothing but the nature of sputum is one is thread-like and light, and this in this case it is yellowish. And the increasing time, the precipitating time and the precipitating factors are more or less kapha predominant. That's why he explained the condition that is getting increased at the time of early morning, at the time of kapha kala. The previous one it was paithiga kala, and this one it is kabhaja kala. The problems get increased. You can just ask the patient; he will definitely answer that. Definitely at the time of awakening, at the time of 4 to 5 a.m. or 6 a.m. I'm getting at that. They may not say that at the time exactly, but still they will explain that when I am getting up from the bed, the problems get increased. Within half an hour, the problem gets resolved. And when the the sunlight comes, automatically the problems will be all right, and he will not feel any of the discomfort later. So here we can use the medicines as either Guluchadi Kashaya or Punarnavadi or Elakanadi comes here. The churnas like Chariya Karpuradi or Valiya Karpuradi, there are two types of churnas. Avaleham, you can use Murdvigadi Leha. Murdvigadi, that I will explain later. Now let us come to the fifth case. A male presented with 40 years with complaints of severe cough with thick white sputum since 1 month associated with nausea, vomiting, muscle cramps and fatigue. He also explained, he will also tell that the same problem. When I am getting up, the problems gets increased. Within half an hour or within 1 hour, when I start my work, automatically the problem resolves. This is what he will be explaining. And at the same time, he said that I'm getting more discomfort here, and forcefully, when I do the forceful expiration, the problems gets cured. He can spit out a little bit thick sputum, and once that sputum has been passed out, again the problems will be cleared. What could be the diagnosis? Again here also, on auscultation, you can get diffuse wheeze with the high pitched continuous sounds. What could be the diagnosis? Come on. Yeah, it is Kabhaja Kasa only. But there are two types of Kabhaja Kasa. Kabhaja Kasa occurring to Durbala. Yes, exactly. Kabhaja Kasa with that we see. So now let's go. Is Kabhaja Kasa probably with Durbala in the condition. So here the treatment is, you see the conditions, the symptoms: Kaphat Uro Alparu Moha Stimidam Guru Roma Harsho Ghana Snigdha Sweda Sleshma Pravartana. The nature of sputum he explained very clearly, and this is exactly similar, the same as the patient exhibits. Snigdha Ghana Sweda Sleshma Pravartana. Purvahane Purvaratrecha. Again, the increasing time is Purvahane, the early morning time, as well as Purvaratrecha. So the problem gets increased. And here the treatment is Vamana, again Pathya Bhojana, here we have to use all the Ruksha Kriya with the dietary restrictions such as Yava. Because this is the actual Samprapti what we explained in the beginning. That is Udana Rupamavana Atha Pratikato Vayu Limbanutu Samagata Udana Rupamavana. So that blockade, that obstruction of Kapha of Apanavata, and which is getting transformed as Udanavata. And the Patya Bhojana with the Acharya explained as Yavanam Vigridikshayam Kalashayam Chashile. So the Takra, Yava Vigridi, etc. being explained here. What could be the significance of Yava? That we will see later. When we see the next yogas, we will see. Here, we can use the main ingredient, the yogas like Vyagradi Kashaya. There is one Kashaya which is called as Darunagradi Kashaya, which is not available in market, but still it is explained in Sahasra Yoga Jwara Chikitsa. The indication is Mrittukalpam Jwaram Jayeta. So, it's more Ruksha, Tishna and Ushna. Again, Dashamulam Kashaya, along with the Yava Churna, as an Anubana you can use. Aragvathadi or Valsagadiganam. Again, these are all explained in Kabaja Jwara. Aragvathadi Sakshaudram, Valsagadir Jayajwaram. He explained, Acharya explained in Kabaja Jwara Chikitsa. Aragvathadi or Valsagadigana with the honey, with Mathu. Or Dashamulam Kashayam with the Yava Churna as a Praksheva Drevya is very effective in this type of condition. Then Vyagradi Kashayam. When we come to the Churnas, either Panchakola Churna or Shadharana Churna, we can use this. When we come to Agastya Rasayana, Avaleha, it is Agastya Rasayana is suitable only in this condition. That you should be very careful. Not all the conditions that Agastya Rasayana is suitable. Not all the conditions that Smooth Haridegi is suitable. Not all the conditions that Vyagri Haridegi is suitable. Again, if you want to do the proper, again, if you want to go for the Vamanas, etc., you can use this Kantakari Krita as a Snehana Drevya for Snehapana. Now, Kabhajam and Shayajam, Shadajam and Shayajam, we know that we need proper Shodhana therapy. We need to do the Pajana properly, then go to Snehana. Especially, the Pajana can be better not to adopt the Kadu Pajana Drevya. Because here also, the vitiated doshas will be mostly the Pitta and Rekta. So always, if we use much Ushna Dravyas for the Sneha or this Pajanas, etc., so there is a chance of increase of Vidagdha. The Pitta may turn as Vidagdha. So always better to use as Pajana with the Tikta Dravya. Pajana can be done with the three types of Dravya. With the Tikta Dravya, with the Kadu Dravya, with the Amla Dravya. So we have to do the all these Vajana Dravyas has to be differentiated or has to be given in different conditions. Not Panchakola cannot be given all the conditions for Pajana. Shadharana is not suitable for all the conditions because these two are the Kadurasa Pradhana Dravya and this should be given only when the Sama Kapha Lakshanas are expected. Then here usually the Kshatraja and Shayaja, preferably of the vitiation of Pitta and Rekta. Here we have to go for Tiktarasa Pajana, Pajana with Tiktarasa. That is nothing but the Dravyas we can use is nothing but Pajanamradam Kashaya or Amrudotaram Kashaya. Sorry, Pajanamradam Kashaya or even Amrudotaram can be substituted with the Pajanamradam or even Guluchadi Kashaya, etc. We have to adopt in this condition. And either Sudarsana Vati or Sudarsana Churna or Mahasudarsana Vati, etc. is an option here. So this should be the line of the treatment. Now we will come to the Swasa. The yogas we will explain later. So this Swasa we can mainly we have to think in the practical aspect we have to consider only two aspects. That is the Swasa produced due to allergic cause and Swasa produced due to non-allergic cause. So always this is what the better we have to think that whether which is allergic or non. First, our first preference should be, our first line of diagnosis should be whether this Swasa is allergic or whether this is due to any other reasons. So allergic cause is nothing but Tamaga Swasa. Simple Tamaga Swasa we can include. The only one possibility to be the allergic asthma is nothing but Tamaga Swasa. There are the other non-allergic cause, especially because of due to some of the brain damage or some of the other organ damage. Even some of the kidney failure, etc., may lead to Swasa Roga. So such conditions can be, that is nothing but Shudra, Chinna, Mahan Swasa and Urdhva Swasa. All the other four can be termed classified under the non-allergic form of Shwasa. How that we will see now. Now we will see Tamaga Shwasa. Tamaga Shwasa, usually the patient with Tamaga Shwasa exhibits two types of symptoms. There are two phases. One is early the bronchospastic phase, and the second one is what we say inflammatory phase. So in the how to diagnose these two? The treatment here also differs in both the condition. Bronchospastic as well as inflammatory, the condition, that line of treatment is different. So bronchospastic phase, there will be the difficulty in expiration, severe chest pain or chest discomfort, and there will be severe congestion. These are the indicators of spastic phase. And in case of inflammatory phase, usually this is the secondary phase. The spasm continues and there will be respiratory edema. That how to diagnose this respiratory edema and the airway obstruction. There will be severe wheezing as well as there will be the different, the broken type of wheezing pattern will be there. So if we meet a patient, if a patient comes with these symptoms, better we have to diagnose whether he is in a spastic phase and inflammatory phase. The line of treatment is different in both these conditions. That's all. So we know the Tamaga Shwasa, we know very well. From this type of this much medicines, you might have understand that there are different types of medicines explained, different medicines which sufficient or which reduces the different types of vitiated doshas in each and every condition. So, but when we come to Tamaga Shwasa, Acharya doesn't explain any of the dosha vikalpas in Tamaga Shwasa, isn't it? There is no Vadika Tamaga Shwasa or Paitika Tamaga Shwasa or Kapaja Tamaga Shwasa explained by Acharya. Then how to select the Vada Shamana Swasahara medicine or Pitta Shamana Swasahara medicine or Kapha Shamana Swasahara medicine? We have to tabulate the symptoms of Tamaga Shwasa into different kinds. Which are they? That we will see. Dosha Vigal, individual Dosha Vigalpa of Tamaga Shwasa. We know the symptoms exhibited by Tamaga Shwasa are, that is Pradilomam, Siragachan, Udirya, Pavana Kapam, Parigrihya, Sirogrivam, Ura, Parsuya Chapidayan, Kasam, Gurguraham, Moham, Irujim, Pinasam Trisham, Karodi Vravegamcha, Swasam Pranopadabana, Pradami, Tasiyuktecha, Nishtudan Dekshanam Sudi, Kritsat Sayana Susudi, Nishana Swastamichali. Mekam Bushida Pragwade, Slashmala is Chabivatani, Sayapis Tamagoshata, Satya. This is the indicator. So, how we have to differentiate all the symptoms into different three groups. Even no Tamaga Shwasa patient will exhibit all the symptoms. So, the symptoms exhibited by the patient, we have to classify or we have to tabulate into different headings. How to get? See the Pradiromam Siragachan Udirya Pavana Kapam Parigrihya Shirograhana Ura Parsha Grahana and severe Sharira Pida Arati Gurguram Anubashayatu Meka Ambushida Pragvada. These are the symptoms exhibited by Vada Dosha. So if a patient with wheezing along with this type of symptoms, that we have to diagnose it as Vadika Tamaga Shwasa, then only our treatment becomes proper. With the patient, if the patient exhibits severe wheezing along with the Trishna, severe intense episodes or excessive perspiration, we have to diagnose it as Paitika Tamaga Shwasa. If the patient exhibits Aruji, severe running nose, wheezing along with the cough, again the Mekambushi, the Pragvade, we have to diagnose it as Kapaja Tamaga Shwasa. Then only we can make that our treatment more precise and easy. So it is very difficult to diagnose, differentiate or to formulate, to develop a common protocol for Tamaga Shwasa. Many of the patients ask, many of the students ask, sir, what is the treatment line of Tamaga Shwasa? So what I have to say is, sir, there is no definite line for Tamaga Shwasa. Tamaga Shwasa should be again disintegrated, or Tamaga Shwasa should be again differentiated, whether it is Vadiga, whether it is Paitika, or whether it is Kapaja. So now we will see the medicine. This is the allergic condition. Now let us go to the non-allergic. This is what I explained. The second one comes. The first one is nothing but precise diagnosis, and the second one is identification of red flags. The following, you should be very careful regarding the coming 3 or 4 slides. That, as per my opinion, if a person come to you with this type of breathing patterns, you are not supposed to test the patient, because at any time the patient may go to collapse. So which are they that we'll see? There is one Bjork's respiration. You might have seen. The pattern is like this. It will be periodic breathing. Chinnat swasiti vichinnam. Marmacheda rujardida. Sasweda murcha sanaha. Vastidaharuja. Adhodrup vipludakshascha. Muhyan rektegarojana. Shushkasya pralabandhino. Nashtachayo videna. So the second and third lines will better not to go to much detail. But the pattern should be very, you should understand, you should observe the pattern of the chest, the movement of the chest. Even though if you are not able to auscultate properly, or if you are not aware to do the proper auscultation, you should observe, you should ask them to remove the clothes, and you should observe the movement of the chest properly. There will be Chinnat Shosidi Vichinnam. He will just, the breathing pattern will be like this. He will do like this, and there will be a no wheezing zone for a short time. Again, you will start like this. Again, there will be a loss. Again, you will start. If you are happens to any patient exhibit to you, comes to you with this type of symptoms, where it may not be the Chinna Swasa, or it may not be Bjork's breathing. So, but you should be very careful regarding the diagnosis. And this could be due to any of the injury of the pons. Injury of the pons, injury of any type of brain injury. It may be some of the tumors. It may be some of the, what was the previous traumas, whatever it may be even the fits, the seizures, etc. also can cause injury to the pons. If any wheezing pattern are exhibited like this, you should refer the patient at least, or to the proper, either the neurologist or the at least to a general physician, or else you should take an EEG definitely to identify the to exclude the possibility. Chinnat Swasiti Vichinnam Marmacheda Rujardida. Then comes the another pattern, that is Usma-Wolf's breathing. It is known as. We'll see the pattern. There will be deep inspiration like this. It will be both the expiration and inspiration will be deep, and there will be a no wheezing zone. Again, will be like this. Mahata dino nadena swasati krathan. Udhuyamana sabdamto mattarshabhaivanisam. Severe mattarshabhaivanisam, like what we say, the mad ox. So he will be just doing, he cannot sit, or he cannot lie down, or he cannot walk, whatever may be. He will be in such a condition that sarvasu avasthasuna sharmalapa. Whatever may be the condition, he will not be able to, he will not get any type of release. If a breathing patterns in your practice, if you come to do like this, definitely, and the patient will definitely, the term is called as air hunger. He will just do the forceful inspiration as well as forceful expiration. Such conditions, you have to think of any of the type of, there are different types of conditions, maybe diabetic ketoacidosis, it can be uremia, or it can be sepsis. A chronic diabetes, etc. If a breathing difficulty or wheezing occurring to a chronic diabetes, you should always suspect the ketoacidosis. Again, these are all a fatal condition that you need a ventilator support in this condition. So always be careful. Here also, you should undress the patient, and you should observe the movement of the chest properly. Now, you might have seen this Urdhva Shwasa, and there is another condition called as apneustic breathing. Again, Udirkham Urdham Swasityurtham Naja Pratyaharatyatha. The Urdhva Shwasa will be there, but the inspiration will not be like this. And there will be the pattern will be like this. Again, there will be a forced inspiration. There will be a blank area. Again, there will be the same pattern will be repeated. This also, you can see the what we say, the breathing difficulty, especially in case of stroke, etc. You can just observe. Definitely, all of us, all the Ayurvedic physicians might have seen at least 1 or 2 stroke patients. So you just think, you just examine from your next day. You just examine your the patient's chest, especially in the stroke patient. Their respiratory pattern is a bit different. It will be like this. There will be a blank area, it will be like this, and again there will be a blank area. So always if you come to this type of conditions are increased too much, that also is alarming. In stroke, etc., there can be it's a normal line, their breathing pattern itself like this. But if the condition is more severe, then you have to refer to a patient where you have to get a ventilator support. So the first two, especially the allergic condition, the allergic asthma we can treat properly, and the other conditions we may be able to treat, but still you should be aware of such type of presentation. Now let us focus on the yogas. We will see the Kashaya yogas now, isn't it? Some of the Kashaya yogas, the common Kashaya yogas we will explain. Here I included Vyaghryadi Kashaya, Dashmula Kadatrayam Kashaya, Nayopayam Kashaya, Balajiragadi Kashaya, Elaganadi Intuganta. I am explaining this in comparison. So Vyaghryadi Kashaya. This Kashaya is explained in Jwara Chikitsa of Ashtanga. Vyaghri Shunti Amradakwata, Pippali Churma Samyuta, Vada Sleshma Jwara Kasa, Swasa Penasa Shula. Vada Sleshma Jwara Kasa, Swasa Penasa Shula. So indications are Vada Kapha Jwara, Swasa, Kasa, Penasa, Shula. This Shula, it can be either Parsha Shula, or it can be Amaja Shula, or it can be Kaphaja Shula. The site of action of this yoga is nothing but Amasya as well as Udas. The properties are Ushna. This yoga is Ushna, Tishna, Sroto Shodhana, Deepana, and Vatakapashamana. This yoga has got more action on either Pranavaha Srotas as well as Annavaha Srotas. So have you seen this one thing? One interesting factor. Vyaghri, Shunti, Amrita. 3 ingredients. Vyaghri, Shunti, and Amrita. And Pippali as a Churna, as a Prakshepa Dravya. Why Acharya included this Pippali as a Prakshepa Dravya? Why he didn't do this as an ingredient itself? That is the main thing. That is that points or that factor points to the nature of the yoga. Why can't he include this also? Instead of 3 drugs, why can't he include Vyaghri, Shundi, Amrita plus Pippali as a Kashaya in the Kashaya itself? There is a great logic, that is this yoga, the indication of this yoga is nothing but Jwara. The next stanza explained as Ushma Pittadride Nasti, Jwaro Natyushmana Vina, Tasmat Pitta Viruddhani, Tejet Pittadhiyatya. As Jwara is a Pitta Pradhana Vyadhi, especially in case of Vaitika Jwaras, you have to avoid all the Ushna Tishna Prayogas. That could be the reason for this adding this Pippali Churna. Here, the Acharya needs the Pippali Churna, the properties of the Pippali, that Ushna, Tishna, etc. properties that is needed here to break the avarana of the yoga, the avarana of the kapha. But that should not provoke pitta also. For that purpose, as a Prakshepa Dravya, that is in the small quantity, Acharya explained, Acharya asked to include this Pippali as a Prakshepa Dravya. So, Vyaghri, Shundi, Amrita, Kvata, Pippali, Churna, Samyuta. So these are the practical. Now, as I previously explained the common properties of the yoga. But now we have to see what type of presentation we can give this Vyaghryadi. Where we have to give this Vyaghryadi Kashaya. Where we have to give this Dashmula Kadatrayam Kashaya. Where we have to give this Intuganta Kashaya. Or what symptoms are exhibited by the patient, you have to select this Vyaghryadi. That is the main thing that we have to know. We know, as I explained previously, this is Ushna, Tishna, and Vada Kapashamana, and this is Sroto Shodhana. So everything is correct only. But not only that is not something, that is theory part. We should understand the symptoms exhibited by this. When the patient exhibits these symptoms, you should select Vyaghryadi. When the patient exhibits these kind of symptoms, you should select Dashmula Kadatrayam. So such a differentiation we will go through. In case of fever, what could be the fever should be if the patient exhibits mild fever, because Vata Kapha Jwara, always Vata Kapha Jwara is a mild fever. Tapa Hani, it is explained. Tapa Hani Ruji Parvasiroru, Penasa Swasana Kasa Vibantha. It is explained. So a mild temperature, the patient exhibits very mild temperature, but there is we can say that's a rise of temperature, not a fever. If the nature of cough is much productive, if the nature of cough is sputum is thick, severe, whitish, patient may even complain as heaviness to the chest, but very difficult to explain. In case of Swasa, in case of breathing difficulty, if the patient exhibits the symptom as difficulty in expulsion of sputum, he say that there is some tightness of the chest, but I cannot spit it out. In case of Shula, either it can be Parsha Shula, or it can be Amaja Shula, or Kabaja Shula. That is like that. So in such conditions, you can the best option is Vyaghryadi Kashaya. If a patient exhibits mild fever, productive cough, thick whitish cough with difficulty to expel, or the expulsion of much thick white sputum, the best option is Vyaghryadi Kashaya. Now we will go to the Dasamula Kadutre. Dasamula Kadutre, Kashayi, Savrushaireva, Makshiga Praveda, Swasana Anila, Kasa, Parsha, Prishta, Trigamurtha Rujansu Pravish. Almost Vyaghryadi and Dasamula Kadutre has got some similarities and some differences. What are they? That we will see. Here the yoga explained in Sahasra Yoga only. So here also the site of action is Amasya and Urus. The properties are Ushna, Deepana, Pachana, again Vatakapasamana. Almost all similar to the Vyaghryadi only. But because of the presence of Dasamula, this Dasamula Kadutraya has got an extra added property, that is Shobha. How to Shobha in the Urus? Not all the Shobha. This cannot be given in the Shobha, what we say, the pedal edema, or any other, what we say, the abdominal edema, etc. This Shobha typically refers to the edema related to chest, edema related to lungs. That is, it can be either pneumothorax, or it can be pleurisy, or it can be pyothorax, or it can be hemothorax. Whatever it may be, whenever the patient suffers from, is diagnosed as a pneumothorax, etc., that we need the Shobhara kind of medicine. That too, Shobhara with an action over the Urus. There are other Shobhara medicines also, isn't it? There are Punarnavadi Kashaya is there, Sukumara Kashaya is there, there is one Arthavilyam Kashaya is there are Bhatyadi Kashaya is there. These are all Shobhara medicines. But all these medicines have got actions on different systems. Brihatyadi can be given in the Shobha produced due to the renal pathology. Arthavilyam can be given in the symptom, the Shobha produced due to the abdominal pathology. Sukumaram can be given in Shobha produced due to the abdominal pathology. But in case of Dasamula Kadutraya, the Shobha which is related to the chest, that is lungs, the Swasa Roga, we can use this Dasamula Kadutraya as an option. Here also, as Vyaghryadi, we will see this Dasamula Kadutraya, where we have to give this Dasamula Kadutraya precisely. If the type of intermittent fever, again Vata Kapha Jwara, nature of cough, whether it is dry or scanty. If the patient exhibits nature of sputum as nil or scanty, or patient may complain as dry cough with the presence of very less sputum, but very difficult to explain. And another thing is exertional dyspnea. Then again, flank pain, especially the the pain produced due to the excessive strain during the cough, etc. The best option is Dasamula Kadutraya. Now we will compare both of this, Vyaghryadi and Dasamula Kadutraya. So Dosha Samanatva, both Vyaghryadi and Dasamula Kadutraya are Vata Kapasamana. Vyaghryadi is Kapadhiga Vata Kapasamana, and Dasamula Kadutraya is Vatadhiga Vata Kapasamana. That means the Kapha symptoms are more, Vata symptoms are less. You can just opt Vyaghryadi. And Vata symptoms are more, Kapha symptoms are less. You can select Dasamula Kadutraya. Vyaghryadi and Dasamula Kadutraya are equally Ushna. Tikshna properties are more with Vyaghryadi. Srodoshodhana is more with Vyaghryadi. Deepana Pajana, both are Deepana Pajana are more similar. Shobhara, again, as I explained, Dasamula Kadutraya is more Shobhara, and Vyaghryadi doesn't have Shobhara property. Kapha Nisarga properties, comparing to Vyaghryadi, has got more Kapha Nisargatva, that is expectorant properties, more with Vyaghryadi comparing to Dasamula Kadutraya. This is how we can compare both these workers. Now we will see another condition, that is Nayobhaya. Only 3 ingredients, Balaji Raganagara. Reference is Chikitsa Manjari, Swasa Hitma Harampara. These are the ingredients. Swasa Hitma. Again, see the ingredients Bala, Jiraga, and Nagara. Properties are Vata Kapasamana, Pajana. So this is Pranava Srodhas and Annava Srodhas. Now, here, where we have to select this Nayobhaya and Kashaya. fever, there is no much action with the Nayobaya. Nature of cough. If the patient exhibits severe dry cough or very scanty of sputum, again nil or scanty of sputum, again dry cough with very as like this the similar criteria. Again, this is very effective in case of exertional dyspnea as well as hiccup, severe type of hiccup. Then the main important area is GIT related. Bala, Jiraka and Nagara. Due to the presence of Jiraka and Nagara, the Nayopaya Kashaya has got a very extensive property, or it's very much effective and effective in case of GIT disorders comparing to the Vyagyadi or the similar. So in conditions like aseptic disorder, abdominal distension, spasmodic abdominal pain, etc., this Niopium is very effective. And if the patient complains with dry cough along with abdominal distension, you can select this Niopium. Patient complaint, dry cough along with what we exertional dyspnea, you can select this SOE Niopium Kashaya. Again, the patient complains with what we say loss of appetite and severe type of vomiting sensation. The best option, the wheezing with vomiting sensation or wheezing with the hiccup, the best option is nothing but Nayobaya. Now see the other medicine called Balaji Ragadi. Here also Balaji Ragadi also we can say this Balaji Ragadi as fortified Nayobaya. All the three ingredients are there in Balaji. The three ingredients present in the Nayobaya is there with Balaji Ragadi also. Balaji Raganagara. Again here Balaji Ragavillo Usta Vusha Vishsuratuvi Guhekshu Laja Sajide. The yoga is mentioned in Sasya Yoga, Swasa Kasa Harampara. Here, which is the site of action, is Udanavada and Dhyanavada. The medicine is Ushna, Lekhu, Vada Samana.
इतना ध्यान कैसे रहेगा?
तो मतलब हमको इतना ध्यान कैसे रहेगा?
पेशेंट डिस्चार्ज है बंदा, हम उसमें एंट्री कर रहे हैं
तो क्या हम उनको अपॉइंटमेंट दे रहे हैं? हमारा काम है अपॉइंटमेंट देने का, डिस्चार्ज हमारा काम नहीं है।
सॉल्यूशन कैसे होगा?
सॉल्यूशन माइंड को जगाओ
यार, माइंड को जगा दे, लेकिन कुछ
क्या करें? भूख लग रहा है मुझे बहुत तेज।
पहले इसका बताओ, ये
पहले बताओ कुछ खाने को है तभी बताऊंगी मैं।
खाने को अभी खिला दीजिए।
नमकीन नमकीन होती है आपके
खत्म हो गई, देख लो खत्म हो गई, कर लिया है ये। गाली देने का मन कर रहा है तो ऐसी गुस्सा हो रहा है। ये देखो, इसमें कितने सारे पेशेंट डिस्चार्ज है, शायद सुमन तनवर भी डिस्चार्ज है, इसका नाम नहीं लिखा। नेहा यादव भी डिस्चार्ज है, नेहा डिस्चार्ज नहीं पक्का, ये तो डिस्चार्ज है। ये सुभाष चंद्र दीक्षित और एक ये क्या नाम है,
सुमन दीक्षित। कल एक रास्ते में पकड़ लिया, मैडम आप जा रहे हो जल्दी? मैंने कहा मैं आज लेट जा रही हूँ।
उसे दोनों मिल गए थे यार। ध्यान रखना देखिए अपनी इस चीज़ का।
सर मैं किसी को इस चीज़ का ध्यान रखूँ बताओ, फिर भी मेरे को यहाँ पर छोटा सा बच्चा समझ सकता है।
मान लो जैसे फाइल फीमेल अलग हो गई है, उन्होंने पहले डिस्चार्ज कर दी, मुझे कैसे पता लगेगा भैया फीमेल?
कोऑर्डिनेशन भी तो मैंने देख लिया आज, कौन से कौन की कोऑर्डिनेशन हो रही है।
क्या कोऑर्डिनेशन? किसकी कोऑर्डिनेशन? क्या हुआ बताओ?
आप लोगों में अच्छे से बात नहीं होती, नोटिस किया मैंने।
होती है
अच्छे से नहीं होती।
मैं ये थोड़ा दूर है, तुम्हें ज़्यादा नहीं
मैंने नोटिस कर लिया।
समझे तो उससे काम करो, डिस्करेज आ रहा है।
मैंने वही तो फिर कोऑर्डिनेशन करो, उनसे पूछे कौन कौन डिस्चार्ज करेगा अपने, फिर वो बोलेंगे ग्रुप में देख लो।
ग्रुप में देख लो, नहीं ग्रुप में तो देख सकते हो, इजी होगा काम, इजी होना चाहिए। उनसे पूछने काम जब हो रहा है तो मैं ग्रुप से देख लूँगा ना। अच्छा यार, तो मुझे भी पता लगा ये चीज़ नहीं लिखनी, मैं तो लिखे जा रहा हूँ।
इसलिए तो मैंने नोटिस कर लिया था, बट मेरे को आपको बताने का टाइम नहीं मिला। और आप इवन ये भी लिखने में गलतियाँ करते हो।
नहीं, ये लिखने में गलती नहीं है।
लगा लो
फर्स्ट डे करिए,
शर्ट लगाओ।
देखो नया काम है, फर्स्ट डे में मान सकती हूँ।
रानी
वही तो मैंने पूछा, तुमने नोट में लिखा है तो मैं तो लिखूंगा ही ना, और तुमने फ्लो में लिखूंगा ही, इसी का तो मैंने पूछा था ना। वहाँ पे लिख दो भाई, सामने इतना ध्यान नहीं रखना, लिखते जाते हैं। तुमने नोट में लिखा, मैं वहाँ पे उसी में लिखा हुआ रजिस्टर में देखो।
काव्या के उसमें लिखा हुआ है क्योंकि काव्या के रूम में करेगी, रूम की कमी है ना अभी।
तुमने ब्रैकेट में लिखा है?
हाँ हाँ
पक्का लिखा है?
पी रामचंद्रन सेल्स के रूम में हो गई है, सेल्स कर रहा
हाँ
है।
ये सेंस कर रहा है।
सुनीता चंद्र में रंजीत मालाकर हमेशा गलत होता है, अनूप लिखा होता है, मैं अखिल लिखती हूँ।
तो यार अखिल का तुमने बना ही नहीं रखा है।
बीबी शर्मा का करो,
क्या बोलूं?
बीबी शर्मा का सेंड करा लो।
अच्छा आगे
तो ध्यान रखना कुछ, और नए थेरेपिस्ट का एक कॉलम बना देना, तुम उसी में
कहाँ पर
लिखते हो,
बनाऊं?
तुम उसी में लिखते हो सारा, इसलिए गड़बड़ी हो रही
आगे
है।
कॉलम नहीं बना सकते ना,
तो ब्रैकेट में
वो
मेंशन कर दिया करो।
ब्रैकेट में मेंशन होती है, रूम के अकॉर्डिंग बने हुए वो कॉलम। डिस्चार्ज आने चाहिए मुझे, मेल डिस्चार्ज।
कोई ऐसा दिक्कत नहीं है,
क्या?
मतलब अपने काम से मतलब हो तो ज़्यादा नहीं फालतू वेट नहीं,
मैम तो कुछ बोला ही नहीं, मैं तो ऐसे ही बोल रही हूँ।
कोई इशू नहीं है
वो
सब।
देना
क्या
मेल डिस्चार्ज लाई थी ना मैं आपके लिए,
ये तो वैसे हो ना,
मेल डिस्चार्ज के बाहर ही है।
नहीं
ये में करना है।
कोई चीज़ का ध्यान देना, जहाँ पे कोई नहीं वहाँ पे करना है। तो मैं तो कॉलम के हिसाब से लिखता हूँ, नाम तो कॉलम में लिखता हूँ, उसका ध्यान जाता नहीं है, तो
वो
शायद राइटिंग
इसलिए
में।
इसलिए मैं पेन से फेल कर देती हूँ, जो इसको कर देती हूँ।
ठीक है, जो हो इनकरेक्ट मुझे करेक्ट कर देना ताकि आगे से गलती ना हो।
ठीक है। और कुछ सर?
ये फाइल ही मेन होता है रजिस्टर, क्योंकि सीक्वेंस भी मेंटेन करना होता है इसको।
मुझे भी इतना ये मेंटेन करना नहीं आता।
यस सर। डिस्चार्ज या रजिस्टर में दो फाइल का है। मुझे कुछ नहीं लग रहा डिस्चार्ज में। इसमें से पंकज सर की फाइल निकालनी है। सर को साइन करवा रहा हूँ।
क्या?
कितने बजे देना होगा? आरके गिरी और वीरेंद्र कुमार शर्मा का इंटरव्यू का बिल बन जाएगा।